Hello, Dr. Dmitry Tsvetov here again, Temecula Dental Implants and Oral Surgery, and today we're going to continue our video series on All-on-X Teeth in a Day procedure with a special focus on what is known as 24-hour teeth. Now, I will go into more detail as far as what the term means, but again, just to make sure we're all on the same page, what we're talking about here is All-on-X Teeth in a Day procedure, where we are replacing all of the bad teeth in the arch, top and the bottom, with the dental implants and then a dental bridge attached to those teeth. Excuse me, the dental bridge attached to those implants. Now, what needs to be explained is that in this process, there are typically two sets of teeth that one needs to go through. One is called temporary or provisional teeth, and another one is called final teeth. Now, a typical process for something like this is a patient would have the surgery, and on the day of the surgery, temporary teeth would be attached to those implants. 3 months later, patient would be back in the office for what we call stability check, which means just making sure implants have healed, and also, of course, the process begins of perfecting the smile, adjusting the prosthesis to the point where a patient is happy, and then the final teeth are made. With a 24-hour teeth process, what is being experimented with is the final teeth, the last set of teeth patient is going to wear, are delivered or placed into the patient's mouth 24 hours after the procedure. If you can see here, in my left hand I have temporary teeth. In my right hand I have an example of the final teeth. The final teeth, as you can see here, they have a titanium bar that is making the whole prosthesis stronger. And that's what's basically distinguishing the temporary teeth from the final teeth. So on the face of it, the idea of having the final teeth within 24 hours can sound very appealing. It can definitely be a good proposition for the patient, because patients can rest assured that they only have to go in, get the surgery done, 24 hours later they have the teeth placed and they never have to worry about a thing again. But as you're going to see in the next few minutes, there are actually quite a few things to understand and to consider prior to deciding that 24-hour teeth is the way to go. I actually think that it's the opposite. It's better to take it slow and actually get the results that you want. As you can see from this slide, there are definitely some advantages to the patient on a lot of fronts from using the delayed teeth approach. With the delayed approach, it allows financial flexibility to the patient first and foremost, meaning, at least in this office, we don't expect our patients to pay for the procedure right up front for the whole thing. No, you kind of pay as you go. So when the surgery happens, you pay for the surgery. When it's time to deliver the final teeth or the final prosthesis, you pay for that. The offices where they do 24-hour teeth, or some that even do the traditional method, they expect you to pay for the whole thing up front, which of course creates a huge financial burden on the patient, and I don't think it's advantageous to the patient at all. The second thing is that once you have the surgery, you have to account for the natural period of healing and reformation and reshaping of the gums, right? Immediately after the surgery, everything is swollen, it's tender, it's bleeding. Okay, yes, you can put in the final teeth, but you have to understand that the gum tissues will naturally heal, and everything heals by shrinking. So the gum tissue will actually retract from the underside of the prosthesis. Now, what is that going to create? It's going to create a huge gap between where the gum tissue is and where the prosthesis is. And this particular gap is going to be trapping a lot of food and a lot of material that is going to be very problematic in terms of the cleaning. Now, if you already have final teeth in place, that's it. That gap is going to stay there no matter what. However, if you start out with the temporary teeth, go through the period of healing, and then make the final prosthesis based on where the gum tissue is 3 months after, that's going to be a more precise fit and allow for much less food entrapment and for much better oral hygiene overall. Now, as much as we want to live in a perfect world, we know that that doesn't always happen. And with all-on-X procedures, sometimes anywhere from 8 to 12 implants are placed into the jawbone at any given time. Now, I would like to say that all of my implants heal perfectly each and every time. That is not true, and I'm not stating that at all. As with any procedure, there's always a chance for failure. So what happens if you placed 6 implants into the top arch and 6 implants into the bottom arch, and you attach a final prosthesis to that? What happens if one of the implants does not heal well? Now your final prosthesis is now supported by 5 implants, because guess what? If you want to replace that one failed implant, you have to replace the prosthesis as well, which kind of negates the possibility of 24-hour teeth and the final prosthesis 24 hours later. With the delayed process, again, you have the teeth in place. If one implant fails, no big deal. The implant is replaced. You wait another 3 months for that new implant to heal, and then you go to final teeth. And then your prosthesis is still supported by 6 implants. So it just makes total sense to wait and not rush things, to allow for a more predictable and a better outcome. Last but not least, and actually probably this is the most important thing, is that what if you don't like the teeth that were placed in there 24 hours later? And some of the things that you don't like about them may not become apparent in the first 24 hours either. What if you don't like the way one particular tooth edge feels? Or what if you don't like the way your smile looks? What if you want the teeth a little bit more forward and a little bit more down? Guess what? Once you have the final teeth, that's it. There's no going back. But going through the period of the temporary teeth and actually having that trial period, understanding what is it that you like or not like about the smile, how you want it to be different, how you want your bite to be different, is actually advantageous to you, because all of those recommendations and changes can be communicated to your doctor, and your doctor can communicate it to the lab technician, and the teeth can be redesigned so that the final outcome is exactly and precisely what you want. Okay? So, again, just to summarize, the delayed approach, in my view, is the way to go. No matter how appealing 24-hour teeth are, they work, but in my opinion, they don't work as well as the delayed ones. The delayed approach allows greater financial flexibility to the patient for the reasons that I already described. It allows a more precise design accounting for the swelling of the tissues and the gums. It allows for changes which are fairly easy to make in case one of the implants fails. And as we talked about, it allows the trying the test drive period. The disadvantages of the 24-hour teeth, again, it's more expensive for the patient because you have to pay for the whole procedure up front. What happens if one of the implants doesn't heal? Is your doctor gonna redo the final prosthesis for free for you? Maybe a question to ask. What if aesthetic or speech problems develop? How are you going to address that? And again, this particular approach, in my opinion, is only advantageous to the doctor offering the procedure because of 2 things. Number one, the doctor gets more money up front, which to the doctor, I mean, it's a business, it is more advantageous. Plus, he sees you less for the follow-ups, right? We see our patients 4, 5, 6 times during the healing period. The doctor who puts in the final teeth, out of sight, out of your mind. You got your final teeth. I don't want to see you again. So, in my view, 24-hour teeth is more driven by the bottom line profit and not necessarily by what is best for the patient. I know this is controversial. I'm probably going to have some colleagues hounding me for even talking about this, but I feel like it's important information to share with the prospective patients, and I hope you found it useful. This is Dr. Dmitry Tsvetov, Temecula Dental Implants and Oral Surgery, talking about 24-hour teeth versus traditional approach. If you're considering getting all-on-4, all-on-X procedure done, please give us a call. We offer free consultations, free virtual consultations. We would be happy to take care of your needs. Thank you very much for your attention.